Hello, you are welcome to today's class. My name is Dr. Isagboyin Henry, and we are continuing our discussion on human nutrition. And we're looking at lesson note 35, titled Dietary Assessment. The Dietary Assessment. The dietary assessment involves the evaluation of food intake to determine whether a person's diet meets nutritional needs. Now, this assessment helps to identify deficiencies and all the imbalances in nutrient consumption, and also it supports public health intervention. Now, what are the methods of dietary assessment? You have the 24-hour recall, you have the food diaries, you have the food frequency questionnaire, and then you have the diet history. Now, for each of them, the 24-hour recall, this method involves a detailed interview where individuals report all the food and beverages that have been consumed in the past 24 hours. It is actually quick and it is inexpensive, but it relies heavily on the participant's memory. If he remembers, good. If he doesn't remember well, a lot of information will be lost. For the food diaries, participants record everything they eat and drink over a specified period. Example, 3 to 7 days. And this method provides more accurate data, but it is labor intensive because you have to keep writing everything you take in. And it can alter eating habits because you have to write. Sometimes you just lose appetite. The third one is food frequency questionnaire. This tool asks individuals about the frequency of consumption of various food items over a long period. It is widely used in large epidemiological studies, but may not be as accurate for assessing individual nutrient intake because it's possible that you forget some details because it is a record of consumptions that have taken place over a long period of time. You also have the diet history, and this method collects a detailed information about long-term eating habits and food preferences, often through an in-depth interview with a dietitian. Let's see the strengths and weaknesses of dietary methods. The strengths and weaknesses of dietary methods. Now, in terms of strengths, many methods like food diaries and FFQ, which we have just talked about, can capture habitual dietary patterns, and it can be used to assess large populations. And you should understand that the 24-hour recall is particularly useful for quick surveys because it is instant. You can still remember a lot that has just happened within a day. But what are the weaknesses? All dietary methods face challenges like memory bias, underreporting, and the influence of social desirability. You could also have self-reported methods which may lead to inaccuracies in report intake of specific foods or nutrients because the person is taking it itself and you probably are not there to be sure that it's writing the correct thing. For dietary assessment in public health, you have the nutritional epidemiology. That's using of dietary assessment. How do we use them in public health? Nutritional epidemiology. I also use them for dietary surveillance. Now, dietary data collected from populations are used to understand the relationship between diet and health outcomes. So when people eat, we want to know what is the resultant health outcomes. And then we want to see, the outcomes such as chronic diseases like heart disease and diabetes, what has led to it, what was eating, what was the habit, so that it can be, serve as a lesson or probably can be used for interventions in the future. You also have dietary surveillance, where governments and health organizations use surveys like the National Health and Nutrition Examination Survey to monitor population dietary habits and identify the trends and also guide the public health policies so that way interventions that will be necessary, updated, and will have impact, recent, current in the population, can pave way. Still talking about the importance, want to see the practical applications in interventions. Practical applications in intervention. Remember, we started with methods of dietary assessment. We have talked about the strength and weakness of dietary methods, and we have seen how it is useful in public health, and I want to see the practical applications in terms of intervention. Now, dietary assessment informs nutritional education. So when with what you have obtained, you can educate people, can educate children, can educate the population It can also provide you with dietary guidelines and also interventions aimed at improving population nutrition. For instance, data on folate consumption in women of childbearing age have informed policies to promote folic acid supplementation to prevent neural tube defects. Because the folic acid is useful, it helps, and when they take it in the appropriate dosage, it will prevent the neural tube defect that happens in women of childbearing age. How about in combined approaches? That is in terms of integrated assessment. The most accurate nutritional assessment often combine biochemical testing, anthropometric measures, and dietary surveys. For example, a comprehensive public health assessment may include anthropometric measurements, clinical signs, and dietary surveys to better understand and address malnutrition. So it is important that you understand that it can be combined with other, areas that we've talked about. In terms of anthropometric measurement, biochemical testing, in terms of dietary surveys, when they are put together, you will find a comprehensive public health assessment. And this indeed will improve measurement, clinical science, and dietary surveys, and that will help us to understand and address a lot of issues concerning malnutrition. And so with this, we come to the end of this discussion, and I hope that you've taken notes, and I hope that you've listened carefully in the 6 minutes of this lecture or 7 minutes of this lecture. And make sure you ask your questions, and do well also to, as much as possible, take notes. It's very, very important. I'll see you in the next class. Bye. Let's continue with lesson note 36. Lesson note 36.